Hello, Dr. David McFadden here from the Dental Implant Center in Dallas, Texas. On our YouTube channel, we often get questions from patients about whether they qualify for implant treatment or not. And I wanted to explain some of the factors or variables that go into my answer. Today I'm going to use these bone loss models that I use in every one of my consultations. What this shows is the progression of bone loss once your teeth are removed. For example, this is maybe you at 20 years old when you had all your teeth. They were extracted and you were given dentures. 10 years, 20 years, 30 years. But that's not true for everybody. Some people go from here to here in one short year. It's amazing what the difference is from patient to patient. And conversely, some people never go beyond this point. They can wear dentures for decades and never get to either of these stages. So again, it's mainly bone genetics. The same is true, of course, for the lower. And this model demonstrates that. With teeth, 10 years, 20 years, 30 years. But again, it can happen much faster or much slower or not at all. The one factor that doesn't involve your genetics is studies have been done for many years about wearing dentures and bone loss. The studies have all proven that denture wear, and it's because of the pressure on the bone, it does accelerate the bone loss, but not for everybody. And I can tell you that in my practice, we treat a lot of patients with moderate to severe bone loss. That doesn't mean they can't have implants. It just makes it a lot more complicated. Many times we have to do bone grafting. But in the front of the mouth, in the upper, from here to here, and in the lower, from here to here, we typically have enough bone to do implants for the snap-on type dentures called overdentures. So in summary, I want you to understand that if you don't have enough bone to have enough implants for implant bridges, that doesn't mean you don't qualify. You could have implant dentures or you could have implant snap-on dentures. And we would put the implants where your bone does currently exist. So those are some of the basic variables when it comes to bone loss and who qualifies for implants. I hope that helps you understand the process. Thank you for listening.